Here's the tumor.
The odd thing is that they call me doctor. You want me to pull the wire out now?
No, don't touch a thing.
I don't even know what I'm doing.
Johns Hopkins is one of America's greatest hospitals. These are the stories of the men and women who work there.
I think there's a lot of attending gossip about us.
Personally, I'm going through a difficult time. You gotta get your emotions under control.
You were acting like a boob.
Without a transplant, he will die.
You have a heart.
No way.
We have multiple gunshot wounds.
It's a war zone here.
I don't want to die.
Years ago, I couldn't, not in my dreams, I thought that I was going to be doing this right here, obviously. I was born in a small little border town between the United States and Mexico. How are you? And all I wanted to do when I first came to the United States is just to make a little bit of money, send it back to my family so we could actually put food on our tables. The only difference now is that I have gotten an education. I went to Berkeley, Harvard, UCSF, but I'm still the same person. Absolutely nothing has changed. I'm the same crazy son of a gun I was 20 years ago. You come to me because I'm a brain surgeon. I operate on the head, on the brain all the time.
Now, for something like this, do I get to go to sleep or do I stay awake?
No, I like to push you to sleep for a shorter amount of time. You know, I always tell my patients that anything that we do has a risk, always. My whole objective is to keep the brain intact, and that's what I would try to do with you. All right, how does it look? Has anybody loaded this?
This is the first case right here.
Because I don't like to bring the patient till I make sure that everything is here.
Dr. Canone is just doing a biopsy of my skull because I have like lesions, I guess, on the inside of it. About 10 of them.
I want my PA right here in the room, please. Give her a call. Where are you? Did anybody check the CT scans? This is going to be a major delay, and I'm not happy about it. Please make sure that it happens immediately. Thanks. The problem is that I have another 3 brain tumors after this. If the day doesn't start perfect as it is, I know I'm going to be here until midnight operating. It just adds another layer of complexity.
This is what I've got. Now, I've reset this to you. This is what I've got. I've got everything you need. They did a great job.
That's an issue that I'm going after.
Call me immediately if you don't have it, and we'll keep trying, okay?
Thanks.
All righty.
I touch these people's brains. I touch their lives, their emotions, and I can potentially change them in the drop of a pin.
Hi, it's Dr. Boyle. When I decided to go into urology, I had to become really comfortable with all the words and all the problems and just talk like, you know, we're talking about the weather.
If you have a hernia, does your testicles hurt?
The first time that someone has to pull down their pants and you have to examine them. Relax. I just act like it's everyday thing because it really is. Okay.
It's all in my mind.
Now I'm gonna have you cough for me. Let me have you bend over here, and I'm gonna use some cold jelly.
Okay.
So your prostate feels a little enlarged prostate, urinary complaints, kidney stones, sexual dysfunction, groin pain, scrotal pain. These things are really common to us.
I never thought it would be an attractive young lady who'd be my urologist when Dr. McFarland referred me. You get that all the time, I'm sure.
No, it really doesn't make a difference.
No, I know.
The only thing I found that makes a difference is I have smaller fingers. My mom is Irish Catholic and very devout and very traditional. I think she thought maybe there was something wrong with me for wanting to become focused on male genitals, as she said. Why do you want to do that? My husband is very secure and will talk to me about all this stuff and is really interested and, you know, enjoys hearing about it. Go on in.
I couldn't sleep last night. Went to bed about 1, but I probably woke up every 30 minutes just from being nervous because I've never had surgery before. Everybody wears these?
Almost everybody.
Let's get rolling.
He's wired. He must have had like 4 cups of coffee.
Irrigation. Right here you can actually see there are some pulsations, so we're not going to get into that because that's dangerous. That's asking for danger. So there are 2 lesions. We got them out. We send the bone to specimen, and this may just be a benign lesion. It looks very benign. So 1, 2, 3 holes right here that were back to back. But I think there's going to be something just congenital. So it looks good. Everything went great. I think this is going to be totally benign.
Oh, good.
You know?
All right, thank you, sir.
Thank you. I came to the United States and I began working as a illegal migrant farm worker. One day I just gathered $65 in my pocket and hopped the fence. You gotta climb it. You gotta be like Spider-Man. Alrighty, so this is the issue. You can actually see the lesion right here, and we're about to investigate that right now by hearing the story from the patient.
I have pain all through here.
Uh-huh.
And I got it over here.
Okay. I think we're probably dealing with a pituitary tumor here. Okay, one that is beginning to give you symptoms.
A month and a half ago, I was supposed to have an appointment for you.
Yes.
And for the endocrinologist.
Yes.
And paperwork got lost.
But my office never gave you the runaround as far as seeing me.
This first time I said, well, I'll call you.
Yes.
So I waited 2 weeks.
The media portrays Mexican Americans, in many cases, as not being hard workers. Anita and Raven, come over here, the 2 of you guys. If I don't make an effort to change that, then who will? This patient has a pituitary tumor. He's been trying to get into my clinic for 6 weeks with a known pituitary tumor. He's called several times the office. No one got back to him. Any explanation?
No, it'll never happen again.
Okay, that's what I thought. All right.
We have oxygen, we have suction. We have everyone.
Sir, how you doing? Hey, buddy. Mr. Bucci, how you doing? You okay? What's wrong? What's wrong?
Last time he got Tylex was like 10 o'clock this morning, and he's been kind of sleepy for me, so I didn't want to give him anything, and he said he was fine, so.
Hello? Full set of labs, ABG. We got a chest x-ray coming. Mr. Bucci, what's going on? Do you know where you are?
This particular patient is in shock.
Show me 2 fingers over here. You're okay.
Which is one of the things that happens when someone gets a pretty severe infection. This guy's got mental status changes, so it's a slam dunk that he's going to go back upstairs to the ICU. This is not going to help my reputation. I've got a reputation of bringing more patients up to the unit than other fellows, so the nurses up in the unit have a little nickname for me. When the patients go back upstairs, they call it bounce back. So whenever I'm on, they're like, great, bounce back Brian's on. I think they're really funny.
Cardiac Sticky, this is Mary Catherine. How can I help you?
Did you hear about Bucci?
Yeah.
You excited?
Am I getting Bucci?
Yes.
You can't handle it?
I can't handle it. I can't handle the truth.
You are such a loser.
You know, why do you gotta be so hard on me?
I don't know.
My dad is a cardiologist back in Oklahoma City. I knew growing up what the hours were going to be like.
Everything's gonna go just fine. We're gonna do the best we can, okay? All right.
In order to really do a good job, you have to put the patients first, which then makes everything else, your family, yourself, everything else, by definition, second. Hey, babe, listen, I'm not going to get... You got to stop. You got to get your emotions under control, okay? You can't flare out like that. You can't talk to your mom like that, okay? Your mom lets you start sleeping in your own bed, babe. Good night. Get in bed. Good night. I love you too. I love you too. She's throwing a fit. All right, is she in bed? All right, hang in there, will you? Please. Hang in there, please. Right. As a couple, my wife and I don't seem to be meshing well.
You were so sweet. You were so sweet. You made me look alive.
She's a great person. She's pretty and she's smart and she's a great mom. I think that makes it more difficult in a way that she and I haven't been getting along.
Look alive.
I have to believe in myself that I can do this better than anybody else in the world. Can I convert from Quiñones to Super Q? You gotta be careful with my cape, bro. So one of my 19-year-old patients ended up having a very bad car accident, and she ended up with a significant traumatic brain injury.
Last January, Tiff was driving, and her car flipped up and hit roof first on a pole. They came to my door and told me that she had been in an accident. And, you cried. Of course. She has receptive and expressive aphasia. So it is very hard for her to speak. But it's gotten a lot better.
I can't think.
Tiff's missing her skull right here.
So what we're gonna do today is we're gonna go ahead and reconstruct the whole skull and make sure that we protect the brain as we do the whole reconstruction.
I'm scared. I'm scared, but I can do it.
Love you, kid.
Hopefully, we can help Tiffany live a full life. And that's why I get all excited about it. All right. How does it look?
It's as stuck as you'd expect.
Yeah. I can probably just cut it right here. That sometimes doesn't matter how good we are and what we're doing. Accidents do happen.
You okay?
I felt the sting of the blood in my eye. I just need to wash my eye, actually. A little artery got me in the eye, so I need to wash it. You never know what kind of disease you can get just by getting stuck, splashed. You get exposed to everything you can imagine. Yeah, it's just such a bummer. You have to deal with all these things, and it also puts a lot of stress on my wife, you know.
Why don't you call Brian Buffet at 11:09? Okay.
Buffet, did you page us? Hey, how are you? My name's Brian Buffet. I'm one of the thoracic surgery residents. So what brings you in to see us tonight? Can't breathe. How you feeling now? Pretty awful? We'll talk more. Your lungs down over here on the left side. We need to put a tube in it over here for you, okay? All right. You nervous? Yeah, that's okay. That's normal. All right, we're going to take good care of you, though, all right? All right. Her lung is completely collapsed right now. Okay, I'm going to get started. If you need more numbing medicine, will you let me know, please? All right.
Okay, sweetie. Okay.
I'm just getting the air out for you. Bear with me. Take a deep breath. Hold tight. You're doing a good job. It went fine. The tube's in, the lungs up. She's breathing better. Are you feeling better? You're breathing?
Better?
Yeah? Sorry about all that, okay? There's no easy way to do it, unfortunately. I know it hurts, and I'm sorry. All right, try to numb you up as best I can. We still be friends? All right. We did a couple VATs. We have one more VATs to go. And Sussman's been busy, too.
Yeah. How was the family?
Great.
All the girls.
Girls are good. They're busy. Good. My wife and I, we've got issues, and we're trying to work through them.
Where's my art? Up in your room. Fine.
We've known each other since grade school. We got married actually right before I went to medical school, and she went to physician assistant school. Yang had asked me to play tennis tonight from 8:30 to 10, but I respectfully declined.
Yeah, that would have been a little much.
We had marriage counseling, and marriage counseling usually sends us into a tailspin for a couple days because you talk about all the things that you never really want to talk about as a couple. Come here. She doesn't feel like I'll ever be able to fall back in love with her again, and if that's the case, then she wants to move on.
I got splashed in the eye here in the operating room. And I need to go to occupational health and get tested or something. Tiffany, how are you, sweetie? What's going on? What's all the shaking right here? Huh? You cold? We're gonna keep you warm. Have you seen your mom? We're gonna get mom to see her? Yeah? Everything went great. You did a great job, actually. Are you happy?
Yes.
You did a great job. I'm very happy.
Are you okay?
Oh, just a little splash in the eye.
Yes.
The only thing that worries me is because she was in the hospital at one point. Probably, I don't know if she got a blood transfusion or not. So, but I mean, it should be okay.
Thank
Okay?
you so much.
Life sometimes can throw you some really hard curves, and you just gotta get up and do it again, over and over.
Is that cock-a-doodle-doo? Is that cock-a-doodle-doo? Oh, no.
I am an only child, and I think that's why I love children, and there's really no greater gift that you could give a couple than, the ability to have a baby. With Evan Cohen, he had had a vasectomy previously, thinking he was done having children.
You may have a seat and I'll be with you shortly.
His new fiancée is young and healthy and has normal, reproduction, and they want to have children between the two of them.
Before I met Evan, I actually wanted 3. And then after meeting him and having 3 step-kids, I'm happy with just 1 or 2.
She's a great mom. She treats my kids like they were her own, and any guy would be crazy not to want to start a family with her. Our relationship depends on us being able to have children. I know that's...
I hate when you put it like that.
It does depend on us having children.
I mean, but it's just that it's a very big portion
of your life, of what you're looking for.
That I've always wanted.
And I need to make sure that I can give that to you.
Vas reversal, to me, is a really wonderful option for men that have had a vasectomy that decide they want to have more children.
Hello. Good morning. I'll be right over, okay?
All right. It's supposed to relax me.
He wants to get married and I want to have a baby, so that kind of was the struck of the deal.
Slowly breathe in and out. Very good. Breathe in and out.
Can you paralyze him?
Yeah.
I can't have him moving at all.
No problem.
Thank you.
He's been telling me, don't worry, I'm good. I'm like, well, how do you know? He's like, I know my body, it'll be good.
On this side, I'm just not loving this fluid the way it is. And I'm concerned that he has a blockage, and I have to fix that.
The fluid is not good on the left side.
His obstruction was pretty high, so we just hope that he has sperm in his right side.
I kind of had a feeling. He's always known I wanted a family, so I mean, we didn't really plan when it was gonna happen, but we planned that it was gonna happen.
I might recut this end, Miss Margaret. Whenever we have sperm, it's because of Miss Margaret. Miss Margaret's our angel, and she has a special connection with the sperm god. So, what's your success rate?
90%.
We've been talking about this since...
Beautiful sperm. So we just examined the fluid from his vasal segment, and it has wonderful sperm in it. So what that means is that there's a 95% or greater success rate of sperm returned to his ejaculate, at least on this side.
Yeah, so just want to let you know that he's doing fine.
Okay.
They found sperm and fluid on the right side. Okay?
Okay. Hey, well, I got good news. Yeah, on the right side there was fluid and sperm present, and I know, I'm excited.
We just hope that he has sperm in his ejaculate. So he will see me back in follow-up at 2 weeks. I'll talk to you soon, Miss Margaret. I'll let you know when I find out, okay?
Sure. I'm excited. I feel like I've been waiting my whole life.
No, dude, get in the back. I need you in the back because you're little. Okay, I'm watching. Good job.
My dad is funny, competitive, and tired most of the time. Because he works a lot.
I marvel at the kids in that they are very adaptive to residency. They understand call schedules because that's what they've grown up in.
Whenever you're on call, you're basically up all night, except if you get a break, which is only an hour, so you sleep.
Yeah, sometimes it's not that bad. Sometimes you get quite a bit of sleep. It's just kind of hit or miss.
Once he's out, he'll be a good doctor, make a lot of money and stuff like that.
I didn't mean to be untrue. I hide the trouble I was in. Please hear me out.
Dad, do you think you'll come home in a while to get some sleep?
I'm gonna try to.
It's very apparent to both Amber and I that this is really a 50-50 thing, and it could really go either way. Come on, guys.
I give you just the truth. I give you all I got to give. No more pretty lies.
Everything went great.
Okay.
Okay? He's doing great.
Okay.
Okay?
And is the results still fairly good because of the one
Well,
side being...
you know, you don't really know where the sperm are going to come from.
Okay.
Independent of each other, my outcomes are 95 and over for the right and about 50 to 55 for the left.
Okay. Sex-wise, probably like 4 weeks?
Nope. Sex fine, 2 weeks.
Oh, okay.
Okay, I'm just going to take a peek and make sure everything's okay.
He's ready? Okay. Hi, baby. Smile. Would you like to try some ice chips? No. I just hate seeing them like this.
What did the doctor say?
You did have a blockage on the left side. But your right side's good. But you said we can have sex in 2 weeks.
Deciding who will win in a situation where there are no...
You got 2 other add-ons or something? Yeah. The other cases are very large brain tumors. Very large? Very large.
I've heard that people come from around the country for him to work on. I think I heard he's one of the top 4 in the country. I hope so. My life depends on it.
Get you laying down again.
The guy I work with knew something was wrong like 4 months ago. He said I kept walking into things. He finally came to the hospital when I started falling down a lot. That's when they found the tumor.
Alrighty, we're all done. Okay?
Well, I've always said I'm lucky if I live past 54. Be the longest one in my family.
He has no other past medical history that I can elicit in my discussions with him, as far as I can tell. He's healthy otherwise, obviously. I think that our goal is going to be to come in from this angle right here, and then go after this lesion right here. Good morning, Michael. How are you?
All right.
How you feeling this morning?
Tired.
Best scenario, as I told you before, is that this is a benign tumor, because if that is the case, we take it out and then you're going to be absolutely cured. We walk a fine line between life and death, literally, or between good outcomes and not so good outcomes.
Let's hope this is the right time.
Yeah, this is going to be on the right side, absolutely. So we're looking forward to this. There's always a possibility that he's a young man and he may not wake up from surgery. There's always a possibility that he may have, as I said, a major stroke and be absolutely debilitated for the rest of his life.
I'm scared to death. It's all I can do to keep from crying. So if I stop talking and not say nothing, that's because I'm holding back my tears. Because I don't want to die. Who does?
If it don't hurt, you're not alive.
To hear more of the music from Hopkins, go to hopkins.abcnews.com. Hopkins continues.
People come to this country because they have a dream, and that dream is to better themselves. And you can actually see right here, you can see a group of people, probably just waiting for work. Just 3 blocks down, I am in my very sophisticated multi-million-dollar laboratory trying to find better ways to cure brain cancer. And just down the street is a group of people doing what I was doing just about 20 years ago. It's interesting how people treat you differently, though, and they have. People see me, hey, Dr. Quinones, Dr. Q, Dr. Alfredo, blah, blah, blah. Back then they wouldn't give me the time of day.
Took a little practice with this because it's a little different size napkin than I'm used to.
We believe that family support and friends is very important because if patients don't have the appropriate support, I think their chances of really doing well are not as good.
Spent 7 years in the Air Force. Married twice. 3 kids. The youngest is 25. And as far as where they're at, I couldn't tell you. Their mother took off with them, I don't know, years ago. Haven't heard from them since. I was told they didn't want to see me. I think about them every day. There's a paper ruse. 1 napkin.
Since the first day I met him, I said, Michael, who should I call? I said, is there any family you want me to talk to? He finally gave me the name of his cousin that I am going to contact.
Hi, cuz.
Hey.
How'd you break your foot?
Fell and broke my ankle.
Why?
Stepped down when I shouldn't have been stepping.
We were basically always together growing up. Not only cousins, really, like best friends. Always talking and do things for each other.
Just us left, really.
I can't remember nothing, so I'm writing everything down. I think of a question, then by the time it gets here, I forget what I was going to say.
He has a brain tumor, and we don't know if it's benign or not. And the doctor told me it was in a bad spot.
We don't really know what he has in his brain. So I wanted to make sure that we are all, on the same page and we all understand how dangerous this is. He could potentially not wake up from surgery. He could potentially wake up and be a vegetable. Today I tell you all the bad things that could potentially happen because tomorrow, as I told you before, I feel very strongly that it's all positive energy. So we have a plan. Tomorrow is going to be a long day.
Do me a favor.
Yes.
Get a good night's sleep.
Yes.
It doesn't look infected at all, no. Your incisions look great for 2 weeks.
Okay.
You need to start ejaculating at this point. Okay, we may find sperm, we may not find sperm. Of course, I love to see sperm at the first semen analysis check. And we get that downstairs in our lab. Preferably have you collect it there if you can.
And you said they collect it there?
Yeah, you can collect there, ideally.
Okay.
They have little rooms. They do it all the time.
All right.
It's what they do.
I don't know. I can only imagine what they have in that room.
This bag here is our pornography stash. I kind of know from my fellowship which magazines work the best.
Shouldn't take too long, I hope.
If they get yucky, we throw them out, so.
I didn't want to come out paralyzed, a vegetable, and nothing like that. Can't depend on myself. I don't want to bother nobody else.
How are you doing, ladies? Am I in the right room or not? And the reason why I ask if I'm in the right room is because, 1, I don't see the microscope, and number 2, I don't see the brain lab. I'm just getting ready mentally, just making sure that everything is good.
Take some nice deep breaths for me. You're doing great.
Night, night.
It drains me emotionally, and I think about it, and then the day of surgery, I'm coming in like a tiger, and I pounce, and that day I believe there's no one more qualified than I am to do this case. Rock and roll. Everybody just watch the microscope, please. This is where the tumor is, but we're very careful. We're gonna drill it right now as well. We have taken the bone off, and now we are going to go and look for the tumor. So that's where we are right now, the danger zone. Here's the tumor. Can you see it on the screen, guys? Right now, every move counts right here.
I'm sorry.
Are you okay? Very, very careful, please, guys. I have instruments in this guy's brain. Needless to say, that scared the crap out of me.
Just worried that one of the bad things the doctor said will happen.
Mr. Cohen's here in follow-up. We obtain a semen analysis at around 6 to 8 weeks following vasectomy reversal.
I'm hoping to see anything, but even if I don't, she said it's not anything bad. It just means it hasn't started yet.
I bet on $10 that he wasn't gonna have anything.
Hello.
Hey, doctor.
We have sperm.
We do?
We have great sperm.
What?
We have great sperm.
Right?
Yep.
I owe you $10.
$10. All right. Anything today means that it's open. And that it will continue to be open, and the count should continue to go up, and the motility should go up. What this means is if you're motivated to get pregnant, you want to have intercourse every other day around the time of ovulation.
That's hard with him.
Is it?
Yeah.
Okay.
What?
It is. I'm like, no, baby, you gotta, you know.
Let me explain to you why that is. Every other day is just so that your count can replenish. So you can have intercourse as many times a day, every day, whatever. But within that 2-week period, you actually kind of want to have it every other day. Okay.
Here you go, babe.
Our last breakfast.
That's true.
This is now Saturday night. In terms of how much sleep I'm going off of, probably 2 hours, and then I'm on call tomorrow. So just trying to fight through it and have a good time. I've got 2 of my good college friends here, and so we're just looking to have a couple drinks and stay away from any mischief.
Hey, so anyway, I'm single. Yeah, I bought an '88 Land Cruiser with wood paneling. You wonder why I'm single? I know what women want.
Yeah, but you can put that back seat, like flat.
A lot of single women in D.C.
I think you should define the DC rating scale.
The ratio of good, attractive, successful women compared to attractive, successful men is something like 4 to 1.
What's your intro though? I mean, you've got to have like elite and politics maybe for first 3 minutes, and then
that's his intro. And that face is his intro.
Come on, man.
What is that? Mojito?
A mojito, non-sweetened mojito.
Brian's a character. I didn't like him too much in college because he always got all the girls. Kind of stolen from the rest of us, not so witty folk.
Here's why Brian's venture is more virtuous than mine, or pretty much anyone else's. We all can go home. We can all sleep this off. And maybe even call in sick if we want to. There's only one guy in this entire crew who could not do that, and it's Brian Bethea. No one flips the switch like Brian Bethea.
He's a doctor, so he can solve anything. Medicine, dude, medicine.
There's like a million
Doctor
doctors.
what?
Anesthesiologists, because they're the coolest doctors out there.
Oh, there you go.
Look how cute he is.
Hopkins. We're talking Hopkins. You can ask a doctor anything.
The same hands that were picking tomatoes just a few years ago now are picking brain tumors. You guys see the tumor? I'll take the delicates with the bipolar forceps. Best scenario is that we're dealing with a non-cancerous lesion. That was a tumor. We can't tell what he has until we take a little piece, we send it to our pathologist, and in minutes they give you a sense as to what they're dealing with.
Brain tumor. That's the little thing we got.
Okay, wow. Okay.
Yeah, 생애 is meningeal.
And that would be a good thing.
Yeah, is that for asking? How are you doing? Fine, thank you, Fred. What do you think we have here?
It's fairly straightforward meningioma.
Wonderful news. Thank you.
That's great. Meningioma is a brain tumor. They're usually benign. That is, they don't spread. Now, the problem is that they can be in some place that would cause a problem just because they're a certain size.
Michael, you're just waking up from anesthesia. Your surgery's all done.
The waking up of the patient is a definitive test of how well you did today. Michael, squeeze my hand. Squeeze my hand, Michael. Squeeze. Squeeze my can, bud. Squeeze my can. Michael, squeeze my can. Wiggle your toes. Can you wiggle your toes?
There you go.
Good job.
Yes, very good. Yes. Yes. It's just great. Just great. I mean, this is what keeps me going every day, you know? I mean, I deal with very bad disease, you know? Brain cancer is tough. But every now and then when you just have this nice, very good news, it's just exciting. Everything went great.
So he'll be Mike again.
I think so.
Thank you, brother.
Very good. Okay.
I'm going through a little bit of a rough go in the personal life. Amber and I are sort of at that crossroads where in the next week or two, it's really going to kind of be decided, you know, whether we stay together or decide to go our separate ways. She's asked me to find a place to live, and so now I'm in an apartment, which is hard. She's seen an attorney, and she's got everything ironed out, both financially and in terms of the kids and everything else. It's hard to make a lot of rational decisions when last night got, so Friday to Saturday, 2 hours of sleep, and then Thursday to Friday, probably 3 or 4 hours of sleep. So, we've known each other since 6th grade. She was in 7th grade, and we had lockers next to each other. And I'm not naive to the fact that I'll be lucky to ever find anybody to care about me as much as she cared about me. But just astonished that it's come to this.
Time to go. See if I can go get a nap, get rid of this headache. I'm gonna get a hold of my children after I get better. And it's nice out here.
Hey, nice to see the sun again.
I'm gonna live a lot longer. That's the way it's gonna be. See you at the party.
Yeah, very good. Beautiful day. I remember one day I am talking to one of my own relatives. I told him, you know, I've been thinking about going to school to learn English. We got some beans, we got some rice. And he looked at me and said, this is your future. You're gonna spend the rest of your life working in the fields. And I can honestly tell you that I was in tears. Look, this whole thing is a tumor right here, sweetie. Isn't that gigantic right here?
And that was the X spot for the patient?
The patient was in serious trouble, and I took it all out right here. How we doing? I have failed in many things. You think it's hard what I do, sweetie pie? You
Yeah.
think it's easy?
Yes.
But never in my ability to get up and try again.
If you know what to do.
Yes.
Dave.
That's right, David. You can.
Looking back on the memories.
Never really knew how people thought about me before. Now I know somebody cares, you know. So that's a good thing.
I
on Hopkins.
These probably might be collateral damage.
I don't know what kind of gun can do that.
They know something they're not telling us.
I don't do vasectomies with the intention of reversing them.
Dating nurses is very tricky. You don't know when the next chance this patient's going to get.
Are you scared for me too?
Guys, I'm going big tonight. It has nothing to do with you guys. You guys are the best kids in the entire world.
If they do get a divorce, what's gonna happen?